Good afternoon. I am Dr. Nandini. I hope I'm visible to you as well as the screen is visible to you. So this is one of the series, one part of the series of webinars that we are doing about recent advances in various neurological conditions. Today's focus is on autism, cerebral palsy, and intellectual disability, or basically neurodevelopmental conditions. So I represent NeuroGen Brain and Spine Institute, as you know, and here you can see on the screen NeuroGen Brain and Spine Institute, which is a standalone institute focused on a holistic approach for incurable conditions of the brain, spine, and the nervous system. So why are we here? We need to know why are we here. So either we are parents or caretakers of individuals, children with brain conditions, neurodevelopmental disorders, or we are professionals who are interested in knowing what more can be done for the patients that we are treating. So they can be therapists, maybe special educators, teachers, and medical doctors as well. So what has happened so far, if we look at once a diagnosis happens, or when there is a worry, or there are symptoms, or there are red flags that something is not right in your child, that the child's development is not as per other children, somewhere there is a deficit, you are unable to pinpoint really. So what do? You go from one place to another, you visit various doctors and therapists to get an assessment done, to evaluate, to at least understand, is there a problem? Are we missing something? You go to different clinics and you get a broad understanding that, okay, your child is either, physically developing late, or physical development is all fine, but this child is not speaking, but, hearing is fine. So do therapies, do occupational therapy, do speech therapy, and, that's where your life is at this point. You've been told that there is no cure and you just have to live with this condition and there's no medical treatment. The only thing that you have with you is rehabilitation. However, today we are here to understand what more can be done. And there is a lot more that you can do. So if anybody has told you that you have to live with it and nothing more can be done, it's not true. So what is new? What is it that we are going to go through today? To understand that, first we have to understand what is the old dogma, what is the old thought process which has led us to believe that nothing is possible once there is a problem in the brain. The old thought process or the old dogma was that once the central nervous system is damaged, it is incapable of regeneration. That is the old thought. The new thought is almost about 15-20 years new, not like recent new, but which has been building up for almost 2 decades now, is that some regeneration is definitely possible. There are niches in the brain which continue to multiply lifelong. Just imagine if this would not be possible, then we would not develop new memories, right? Every day we are experiencing new things, we see new things, we look at new faces, and we store them in our memory or hippocampus or a retention box. And how does this happen? This happens because the cells are multiplying and they are connecting as well. So there are niches in the brain which continue to multiply lifelong. And along with niches, it is possible that with the help of cellular therapy, with the help of new tools, it is possible to regenerate the part which is functioning less or which is lost. The old view was that only rehabilitation is available to retrain the brain, or for the plasticity of the brain to ensue. However, the new view is that along with rehabilitation, it is possible to have stem cell therapy. It is possible to have stem cell therapy add on to the way the rehab works, complement the rehabilitation, help the rehabilitation boost its effect. And now we also have what we term as integrative therapies or oxygen-based therapies. So a combination of stem cell therapy with integrative therapies and rehabilitation together will give us a better holistic approach, a better outcome as opposed to only rehabilitation. So this is the new view which you will be learning more about today. So when we do this combination of rehabilitation and stem cell therapy along with integrative therapy, it is possible now to reverse autism and cerebral palsy, and that's what is new about the whole approach. So you must be wondering, I'm talking about the brain, and how come I'm putting up this X-ray of a broken leg? So what are you seeing here? You are seeing that this is a bone of the leg and there is a fracture. This fracture, suppose you and all, at some point in our life, either we have experienced a fracture or we have seen some very near and dear one. Fractures are very common. So what do we do if there is a fracture? Do we start going for exercise and rehabilitation immediately? Do we start putting pressure on the leg immediately? No. What do? We first fix the fracture, either by a surgical method or by a plaster cast. And then once the bone is fixed, that's when we start doing the strengthening of the muscles so that the muscles or the limb can start moving again, isn't it? Just imagine that you have a fractured leg and you start doing exercise saying that, oh, unless I do exercise, it's not going to strengthen my muscles and I won't be able to walk. Okay, that's not, what's going to happen. The fracture is going to worsen in that case. So similarly for the brain is also an organ of the body. If a bone needs to heal first, why not the brain? So we have to look at brain disorders or neurological conditions or neurodevelopmental conditions in similar light. We have to start changing our perception about neurodevelopmental conditions. So we have to look at as a brain which is weak. So when we do a scan, we see that the brain areas are functioning less, and this needs to heal, this needs to rejuvenate, this needs to regenerate and repair. And once that happens, you can see the blue areas here indicating lower functioning brain becoming green. And once this brain starts activated, becomes green, that's where you can do the rehab, training, therapy, which will give you better results. So similar to a fractured leg, we now need to look at the brain development in similar light. And this is what we believe is helping this whole combination of this paradigm of holistic approach and comprehensive treatment, helping a child who's on the wheelchair to stand up and walk, a child who is unable to school to be able to go and communicate and to socialize and go ahead in life. So let's look at in the new paradigm, in the new holistic approach, the first part, that is the stem cell therapy. Just like a stem of a tree gives rise to branches and leaves and flowers and fruit, and please mind you, along with the stem or the leaves, you do have the fertilizer, you have the water, which is very important. So the nourishment is important for the tree to flourish and become stronger, give rise to leaves, flowers, and fruits. Similarly, there are cells in our body which multiply. So what do stem cells do? One cell become many cells, and they can give rise to new blood vessel, neoangiogenesis, formation of new blood vessels, which helps oxygen and different positive chemicals to reach the appropriate area to start the process of repair and regeneration. Along with that, release of growth factors, which will stimulate the cells or brain cells or the liver cells to function better and relearn and reconnect. So what do stem cells do? They multiply, they release positive chemicals, they form newer blood vessels, and ultimately, depending on the environment that they get, they will become the type of cell which that area requires. For example, if you put them in the heart, they will help heart repair. If you put these cells in the liver, it will help rejuvenate the liver. And at NeuroGen, we are using this technique, this technology, this process to improve the brain functioning so that the brain cells get more stimulation. So this is how stem cells work. So this is this new field of regenerative medicine, which is very promising, where healthy cells are used to replace the damaged cells to be able to give a better organ. Here we are talking about the brain. The process can be either autologous or allogenic. Autologous meaning taking cells from our own body, putting it back in our own body where it is required. Allogenic means taking from someone outside and putting it into the patient's body. But where do you get these cells from? Do you go to a shop and order it, prescribe it? When people do ask me that, okay, there are these stem cell products which are there available, do we take them? Do they help stem cells? Do they work as stem cells? Like when we are looking at those are plant-based products, and they generally are antioxidants from maybe a green apple or a green grape. But here we are talking about biological material from the human body. So when we think of biological material, let's start from when we were conceived. Okay? So when we were conceived, we were a one cell stage. So one cell became two, two became four, four became eight, and a bunch of cells. And these bunch of cells had the potential to form the whole baby in 9 months. So just think of their potential, the enormity of the whole scenario, that this bunch of cells, about 30 to 64 cells, can give rise to a whole baby. So these are known as embryonic stem cells. Embryonic stem cells are sourced from in vitro fertilization clinics. You must have heard of test tube babies. And test tube babies, when they are formed outside the mother's womb, a few of them are then implanted into the mother and rest go waste. These waste embryos are used in the laboratory to produce cells known as embryonic stem cells, which have the potential to form each and every cell in our body. So this were one of the most fascinating field which came almost 2-3 decades back. And however, due to ethical reason, because here there is that life starts at conception, and there is a way of thinking that we are killing an embryo, even if it is going waste, we are killing an embryo. And so ethically, there are questions on this. Also, because these cells can form any type of cells in our body, they have the potential to form bunches of cells known as teratomas. These are benign tumors, and this is a characteristic of embryonic stem cell. Hence, because of these two major issues, one ethical and one scientific, the use of embryonic stem cell for in medical transplantation or in treatment is limited. These are very good sources of cells for understanding how the different parts of our body develop. We can use this to do a lot of research to understand how drugs affect our body. Instead of using animals, we can use embryonic stem cells. However, for treatment purposes, they have limited value. Now we have another source which most of us know about, is the cord blood. So because when I say that, oh, I work in the field of stem cell therapy, people ask me, oh, cord blood. So that's what first hits us when we talk about stem cells. Cord blood is a very good source of stem cells. It is the cord which connects the mother and the child, and which basically works as a nutritional medium when the child is in the mother's womb, and as well as excretory medium, has a lot of cells of which belong to the child himself or herself. And when we retrieve this at the time of birth and store it in special storage units known as cord blood banks, they then can be later retrieved for the use for that child if possible. Cord blood stem cells are best used or best known for indications such as blood disorders, where for a sibling has a sickle cell anemia or a thalassemia or a leukemia, and from a normal sibling's cord blood, it can be used as a transplantation medium to help the sick child become better. For neurological conditions, there are certain clinical trials which are going on in Duke University, where the use of the child's own cord blood is being tried. There are a few issues with this type of cell transfer. One, that these cells are stored at minus 190 degrees centigrade in liquid nitrogen, and hence, which acts as a cryopreservant, and hence have to be very careful when we are retrieving it onto room temperature. We'll have to ensure that this is completely washed off of any cryopreservant before putting it into a child or into a human body. Uh, Hence, we are a bit worried, skeptical about using these for brain conditions where we believe that we have to target the brain and inject the cells near the brain. These cells are all right for intravenous injections. Now, when we don't have this option of cord blood, what do we have? We do have a very good source of regenerative material in our own body, and these are known as adult stem cells. The most common source of adult stem cells is the bone marrow. Bone marrow is a source of lifelong source of producing blood in our body till we die. This bone marrow will continue to produce blood, and many people say, "Oh, we are taking the bone marrow from the child. Will that have any problem for the child in the future?" We have been doing this for now 13, 14 years, and no children has any problem. Plus, we have to understand this is a replenishable source. Like when we donate blood, more blood is formed. Where is it formed? It is formed in the bone marrow. So the bone marrow is a factory of stem cells, and we take the bone marrow from the child's own body, separate out the stem cell, and inject it back into the body. So it is one, there is no ethical issue. We are not killing an embryo. It's a very simple procedure. You don't need to store any cells. Our own body has its own potential. Just we have to help divert it. It's like in our country, one place there is a drought, and in another place there is a flood. So what are we doing? We are taking water from the flood, channelizing it to place in the dry lands, so that this potential can be used. And that's what we are doing. We are using the bone marrow of the child himself to improve the brain functioning, and hence this becomes a very potential, feasible, very easy source of stem cells. We don't need to store it. No chemical is required for its separation or storage, and hence very, very natural method. The fourth type of stem cells, which I would just like to briefly mention here, is the induced pluripotent stem cells. It's a in a way, I can say it's a designer stem cell, like our own cells from skin. My cells, for example, can take my cells and we can stimulate my skin cells to go back to its childhood, basically making an adult skin cell into an embryonic cell using certain technology, which is by inducing the adult cell to become a pluripotent cell or an embryonic cell. So this is known as an induced pluripotent stem cell. A lot of work is happening on this front, and hopefully in the future we will have certain major breakthroughs like blood disorders which could be cured by induced pluripotent stem cells. But practically now we have two sources, the cord blood and the adult stem cells from our own body, which are more potential, less side effects, and no ethical issues. At NeuroGen, we choose to work with adult stem cells in a clinical setting, adult stem cells from the bone marrow particularly, because they are 100% safe. There are no tumor formation issues. There are no rejection issues. We are taking from the child's own body, easily obtainable. Using one thin needle, there are no major surgeries, no cut, no stitches required, no ethical issues. We are not killing an embryo, or we are not, we are not using cells which can later form tumors. So, what is the scientific basis of stem cell research or regenerative medicine? Is it something which has come yesterday? Is it something very new or novel? So no, this is a field which has been in a lot of work has happened over the last 40, 50 years. In 1990, Professor Thomas was awarded the Nobel Prize for discovering or demonstration of stem cells in the bone marrow, which we use at Neurology. So in 1990, he was awarded the Nobel Prize. So you can well imagine when he must have started his work. Because got awarded in 1990 means at least roughly 20 years before his award he would have started. So maybe like a 1970 or 1975 he must have started his work. Then 2007, Sir Martin Evans was awarded Nobel Prize for the isolation of embryonic stem cell in mice. Recently, in 2012, two scientists, Professor Gordon and Shinya Yamanaka, were awarded the Nobel Prize for research on induced pluripotent stem cells. So a lot of work and a lot of evidence and a lot of excitement over how these cells are going to be the future, and hopefully in the near future we may not need any organ transplants. So that was about the world research. What is the scientific basis of the work that we do at NeuroGen? Why do we even focus on scientific basis? For us at NeuroGen, it's very important because our perspective is that we have to keep evolving, and every time we have to better the treatments that we are bringing to our patients, and a lot of research goes behind it. So our research, everything that we are doing is is published for peer review. Many people ask us, what is the evidence? This evidence, and it is not an evidence that we have published in our magazine. These are publications of renowned scientific journals, domestic as well as international, and peer reviewed. Means there are 2, 3, 4 scientists and doctors all over the world who have reviewed the information and then given their stamp for publishing in international journals. So 106 publications in national and international peer-reviewed journals, 16 on autism, 15 on cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy, 9 in spinal cord injury, brain stroke. So whole lot of publications. Then the books. So there are international books being written on autism, cerebral palsy, neurodevelopmental conditions, physical disabilities, and these book publishers have invited us at NeuroGen to write chapters on the work that we do, which can pave the way for better treatment options. So, for example, recent advances in autism. This book has a chapter on stem cell therapy in autism spectrum disorders from NeuroGen. Cerebral palsy challenges for the future. This book has a book chapter on stem cell therapy for cerebral palsy and our normal option written again from NeuroGen team. Physical disability book has a chapter on stem cell therapy in pediatric neurological disabilities. Muscular dystrophy, written a chapter for a book on muscular dystrophy. Again, Prime Minister of India, Shri Narendra Modi, visionary himself, has this vision of regeneration and stem cells to be brought to India in a big way, and which is already, way back in 2014, he had shown his support for this field. Recently, when we met him at one of the programs, here is Dr. Alok Sharma presenting the book that we have written on stem cell therapy in neurological disorder to Shri Narendra Modi. When the Prime Minister, when he took over the Prime Ministership in 2014-2015, when he visited Japan, he also went to meet Professor Yamanaka and his lab to see how this research can be brought to India. And an institute known as InStem in Bangalore was started for this purpose. He's a big supporter of muscular dystrophy and has written a preface for the book that we have written in Gujarati.
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहां एक नोबेल लॉरिएट
I'm sorry. So he's talking about his visit to Professor Yamanaka's lab in the Indian Parliament. So now let's look at how is the treatment done. What does the treatment really entail? Is it a big procedure? Is there a cut? Is there stitches? All those worries in parents' mind, we understand that. So the procedure is as simple as we can get with minimal, we call it minimally invasive. So bone marrow aspirated from the hip bone using a very thin needle, as thin as the tip of a pen. Stem cells separated in the laboratory and again cells injected using a very thin needle. So the basis is that we want to reach the brain. We believe that the neurodevelopmental conditions, the source or the problem is in the brain. So how easily can we reach the brain without causing any damage? So if we think about it, there are three ways of reaching the brain. The simplest way would be intravenous, putting the cells IV. So just think. So cells are going intravenously and through the vein, it would reach, one part of through the lungs, go to the right side of the heart. The right side pumps blood to the left. From the left side of the heart, then it would again go to the lungs. From the right side of the heart, it will go to the lungs. In the lungs, it gets filtered. This blood gets filtered, and from the filtered blood comes back to the left side of the heart and gets pumped to the rest of the body. So during this process of filtration, about 70% of the cells given intravenously would get filtered in the lungs. And what would remain maybe at 20-30, and which again gets diluted throughout the body, because of course the blood goes everywhere. Why would it just go to the brain? And whatever reaches the brain, people do ask me, how do you cross the blood-brain barrier? There are coverings around the brain which would prevent the cells from going in. So intravenous is the simplest way. It's the easiest way. However, efficiency is very, very low. So that is one way. What would be the most efficient way? Go directly into the brain, right? So you can, through a process known as stereotaxis, and that has been tried in Germany. There was a center known as the Excel Center of Regenerative Medicine, which for cerebral palsy was doing this, going directly into the brain using stereotactic method. Yes, that is the most efficient way. However, extremely risky and a high chance of morbidity and losing a life. So on one hand, we have something which is very, very simple, just intravenous, like a drip. Anybody can do it. Even a nursing staff can do it. However, the efficiency is very low. On the other hand, we have a stereotactic method of going into the brain, which would possibly be, more theoretically more efficient. However, extremely morbid and highly risky. So at NeuroGen, we have tried to find a middle point. So hence this procedure in which bone marrow taken from the patient's own body, the stem cells this is like thick red blood. Bone marrow is aspirated. This is the separation process in the laboratory. Cells are counted, looked for viability, and then injected using a very thin needle in the lower back. Now, when we inject the cells in the lower back, the cells go through the fluid around the brain and spine. It can go either in the spine or in the brain, only these two places. And research has been done on this to find where do these cells go. And it has been found wherever there is a damage, wherever there is a inflammation, cells are directed towards that place. So now the cells have reached the brain, and now people do ask me, how do they reach that area where the problem is? So let's look at where the problem in autism is. Of course, what is autism? Autism is a multifactorial condition, and it is a multi-dimensional condition. Not one autism child looks like another. Every child has his own set of problems, but broadly there would be one persistent difficulties with social communication and interaction, restricted and repetitive behavior, so rigid behavior, flexibility is an issue, adaptation is an issue, and also impaired functioning of daily living. That is an issue which ultimately leads a child to have difficulty in achieving his usual milestones. So it's a neurodevelopmental condition disorder. We now accept that. It typically occurs more in males than in females, and it is a spectrum. It can be mild, moderate, or severe. And why do we need to know more about autism? Why do we need to worry about autism? Because it is worrisome. The prevalence of ASD is continuously on the rise, and it is alarming at the pace that it is going up. 2004, 1 in 166. 2008, 1 in 125. 2012, 1 in 88, 2016, 1 in 68, 2018, 1 in 59. And I'm sorry, I have not put the recent one, but 2020 shows 1 in 40. Now it's becoming more of a norm than an exception. So hence we need to really understand what is going on. 70 million people in the world are on the spectrum, 1% of the world's population. So as I said, triad of symptoms. Now let's understand better what is happening in the brain. Then we can look at correcting the brain functioning. So this is a scan which is a advanced version of a CT scan where we are looking at functioning of the brain. So broadly, if you look at the brain, the structure in most children appears to be pretty much all right. So everything is in its right place. But somehow, though everything looks fine, there is something wrong. And that's where we looked at, let's look at functioning of the brain. Functioning of the brain can be looked at in two ways. One is known as a functional MRI. What is a functional MRI? You ask an individual when he is in the MRI machine to maybe move his leg or move his hand and see which part of the brain which looks more activated. However, imagine, can you do that in a child with autism? You want to get a scan done, we have to sedate the child. So obviously functional MRI would not be possible unless the child is high functioning and can respond to communications. So we looked at this way of understanding the metabolism of the brain. This is an indirect way of knowing the functioning. So glucose is the only sugar that the brain can use apart from ketones. Glucose is the only sugar that the brain can use for its functioning. So a dye known as fluorodeoxy, so it's a fluoride dye connected to glucose. This dye is injected intravenously in the IV, and this reaches the brain in about 45 minutes. The different cells of the brain will absorb this dye, okay, depending on its function. So number of neurons are important and activity of the neurons are important. So how active are these neurons? Depending on that, the glucose will be taken up by the brain. And this glucose uptake is then measured using a positron emission tomography. So what we are seeing here is a readout of that PET scan. To make it simplified, different softwares are used to get information. So this is the brain, and the green, the yellow, and the red that you are seeing is metabolism from normal to more. So these are all good functioning. So the green, the yellow, and red are good functioning areas. The blue, on the other hand, that you are seeing is lower and lower functioning. So either the blue can be because there is no tissue there, it's only fluid, or it is that there is tissue. However, the glucose uptake or the dye uptake is lesser than what we would expect. Okay, so these blue areas tell us where the functioning is low. And when we look at a brain of autism child, and this we have published a couple of years back, is 3 areas. Okay, this is the cerebellum, the medial temporal, which contains hippocampus and amygdala, and the thalamus. So these are the 3 areas which, if you look at the functioning, cerebellum is fine motor activity, coordination, balance, articulation. Whatever the main brain needs to do, this small brain will execute it. This part here, the medial temporal is for understanding, for learning, command following, memory, cognition, social interaction, emotional expression, and impulse control. Okay, so it sounds familiar, all of these things. And between the 2 brains, you have a part known as thalamus, which is a butterfly-shaped area which connects or relays information between right brain, left brain, and the brain to the spinal cord. So the relay center. That means information processing, bilateral activities where both brain need to work harmoniously. That is effective. So this is an autism. This is again new information. This is some information is of course already known, but this is a reconfirmation and better understanding of what's happening in the brain of a child with autism. This is original data. Interestingly, one very interesting thing came out of this whole study was when we looked at timeline from a 2-year-old to an 18-year-old. We saw that in a neurotypical child, if you look at the blue data line, the brain functioning or brain metabolism continues to increase very fast up to 10 years. And then after 10, it is increasing, however, albeit a bit slowly. So we know that the best Learning happens before 10 years, and after that, there's a little bit of slowdown of the brain, so it continues to grow. Interestingly, in a child with autism, the metabolism initially appears to be higher, and either because of environmental factors or basic certain parts of the brain being not able to, manage to go up to that level where it is supposed to be, the metabolism goes down. And you can see that as the age increases, the metabolism is going down and down. So what do we need to do here? We need to push this graph up to be able to get towards normalcy. So as the age increases, the gap increases. So that's why early intervention, treatment early, is very important in terms of functioning, in terms of metabolism, in terms of training and pruning as well. So what do we have here? We have stem cell therapy. We of course have rehabilitation. Again, that's why it's a multidisciplinary approach. There cannot be a one-pronged approach. There has to be multiple things going together to get the child's overall development to happen. So all kind of rehabilitation therapies. Of course, there is biomedical treatment. We have oxygen therapy, which now acts as we call it integrative therapy. Some people also believe in chelation. So all these together, works well. No, neurorehabilitation, nothing new, but again, focus on comprehensive treatment or working together. Many parents come and tell me, oh, we are doing therapy, we are doing rehabilitation, and we really go into the depth. We are doing only ABA. ABA is important. Behavioral therapy is definitely important. We do believe that improving the child's behavior helps in the outcome of the child's development, because if the behaviors are bad, if the child keeps on throwing tantrums, is aggressive, is destructive, even if the child has potential, he or she will not learn. You will never know what the child is capable of. So yes, ABA is very, very important. But that cannot be the only approach that you take. You have to take you have to help work on the physical aspect, the tone of the body, the motor aspects of the child's development as well. You have to look at occupational therapy. What is the occupation of a child? The occupation of the child is to play and also to brush his teeth, to go to the bathroom, have his bath, wear his clothes, and go to school and study, of course. So occupational therapy helps the child learn these aspects, which unfortunately he is not able to learn by himself. Sensory integration therapy, very important. Why is sensory integration important? Because not only in a child with autism, but many children with cerebral palsy, also an intellectual disability, also sensory processing is affected. What is sensory processing? So somebody touches me, I can understand what does this touch mean. I can understand whether this touch is a pinch, whether it is painful, whether it is a good touch, whether it is a loving touch, whether it is a forceful touch. But a child with autism may not be able to decipher this and hence responds inappropriately to various touches. The manifestation could be the child doesn't like to get his nails cut, doesn't like to get his hair cut, and has a problem of tiptoeing because he doesn't want to keep his foot down on the ground. So this is one example. There can be auditory hypersensitivity. Normal voice, normal sound, the child will close his ears. And this sensory issue then becomes behavioral. And at some point, it all gets mixed up. And sensory processing and sensory integration, very important right from early childhood. So apart from ABE, we have so many other things that are important for the child's development: physical therapy, occupational therapy, sensory integration, speech therapy, not only for verbalization, but also for communication, for chewing, for oromotor strength. Many children don't want to chew their food. They will just gulp it down. So not only is comprehension affected, but also oromotor strength. So speech therapy is not only about speech, it is also about all of these other aspects the child has a problem with. Aquatic therapy. Why do you need aquatic therapy? A child, sometimes many children love water, and the water then they, do better in terms of their posture, in terms of their sensory issues becoming lesser, improved focus, concentration, control of body movements. All of this is helped through aquatic therapy. Art-based therapy. Do things in a fun way. Teach the child in a fun way. Don't make it a big, heavy thing on their head. Using music, using drawing, using play. Let's teach the child in a more fun way. Isn't that what Montessori schools do? Okay. So that is the rehabilitation part. In addition, of course, parents who are familiar with biomedical treatment also, in fact, they tell me more about chelation and DRS and toxins and removal of contaminants in the blood. Supplements, addition of supplements. I believe that nutrition in terms of food is very important. How you can provide all these nutrients through food would be better. However, of course, we understand that many children with autism are picky eaters and hence may not get enough of these nutrition, hence these additional supplements. Diet and nutrition broadly, there are lots of do's and don'ts, and people keep asking me about gluten-free, casein-free diet. I think for stem cell therapy, strictly gluten-free, casein-free diet is not a must. However, this is my personal experience as well as experience from many parents that going gluten-free and casein-free helps the child's digestion to improve, gas formation and constipation reduces, whereby child's sleep becomes better, the focus improves, child's irritability reduces, hyperactivity reduces. So if you can go organic as much as possible, and if you can go sugar-free, and if possible, gluten-free, casein-free, it helps the child. But this advice is always comes with a disclaimer that if the child stops eating because you're forcing the child to eat gluten-free, casein-free, I would advise against it. Do it slowly, do it gently, make the child flexible, but you also be flexible. So look at the situation and do it. But yes, definitely high polished sugar and extreme sweet, junk food, aerated drinks, absolute no. So having treated over 4,500 patients with autism, I would directly, of course, like to go to this paper that we published first in 2013 in Stem Cell International Journal, and this is a scan that you can see the PET scan before the treatment. The blue areas before the treatment indicate low functioning brain, and as you can see lower down, it's not completely clean, but it is resolving. Okay, the activity in these parts of the brain is improving. As the brain functioning improves, you can connect them better. This is another example where you can see the blue areas becoming green. I think this is the most recent publication. I'm going to expand a little bit on it, 2020, where we're looking at 254 patients analysis in depth. Okay. So what are the symptoms that we see? Improvement. We see good improvement in social interaction, better eye contact, attention concentration improves, hyperactivity reduces, aggressive behavior reduces. So a therapist is able to make the child sit and learn better. I find comprehension improves beautifully. The child's ability to grasp information and reproduce becomes better. And then command following, sitting tolerance, frustration tolerance becomes lesser. Speech articulation starts, but you need to use this in a better way. So children do start, taking out words, but to make it more comprehensible, you have to engage the child. I tell parents, do a lot of story activities. Sit with the child when the child is eating or playing and make up stories. We have to be creative parents. Parenting has to now change from rote learning to creative parenting. So, a child with autism information processing is the problem. Input is there, but processing and output is a problem. And that stem cell helps to improve those parts of the brain, the hardware. But you do need to put in the right information which you want the child to process and to be able to bring out. So it is a combination thereby of the stem cell therapy along with training and along with helping the child reach one goal after the other. I do understand that all parents want your child to be absolutely normal in the next 6 months to a year, but it is a process, and we have to follow that process and so that nature can help us as well. Now, when we're looking at clinical scales, how do we look at the outcomes? Not only symptoms, but clinical scales. And the clinical scales that we use is the Indian Scale for Autism Assessment and the Childhood Autism Rating Scale. Here we find significant improvement. Severity based, when you look at severity, all severity do show improvement. The severe will become moderate, moderate will come towards mild, and mild come out of the autism spectrum in a year or year and a half. I believe less than age, of course, less than 5 years is the best for age, while the brain is still, improving, the brain is still growing, and the child has not really gone down too much. So the first few years of life is very important. Less than 5 years, you're almost 97 to 98% is the success rate or better outcome. Between 5 to 10 years is 94 to 95% success rate. Between 10 to 15 years, about 90%. So as the age increases, the possibility of success reduces a little bit. Gender-wise, if you look at males as well as females, both genders improve equally. Duration from diagnosis, if you look at children who come to us within a year of diagnosis, is almost 100% success rate. Those who come between 1 to 5 years, the success rate is 95 to 97%, and above 5 years, the success rate is about 90%. So earlier you come, better the results. Now the evidence. So there is a lot of evidence. There are about 9 publications. You see, the first came from NeuroGen from India, second from China, third from Italy, fourth and fifth from US, from Duke. From sixth from, sorry. Again, sixth from India, seventh from Vietnam, again, eighth and ninth from the US. These are all our publications from NeuroGen, 16 publications on autism. And let's look at a few examples. There are hundreds of examples on our website, which you can go through. There's a few to give you a better understanding of what kind of improvements are possible. This is a child from the US. We've treated from Kentucky who underwent first stem cell therapy at the age of 10.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes. Look at the wall and be talking to the wall. Or he had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade 4th month reading level to a 7th grade 1st month reading level in 5 months.
Ganesh's development is inspirational. And the child who was in special school is now in regular school. He's a teenager. I think he's now graduating. He's in a choir and he sings and he speaks Spanish apart from English. I think admirable improvements, and increasingly parents coming back to us who we've been treating for the last 3-4 years are telling us the child is being shifted from special school to a regular school and is able to cope with the studies and doing amazing academically. The only, I feel the only issues that remain sometimes are a little socialization issues and behaviors. So behaviors, I keep telling parents, work on the behaviors right from when they are 2, 2.5, 3 years old. I understand that parents are, once you get the diagnosis, parents are very defensive as well as very protective. They're looking at their child only as an autism. My request is, yes, your child has a diagnosis, but also look at the child as a normal child. There is a normal child in your autistic child. The behaviors, 50% of the behaviors are coming out as a part of normal development. We need to address those behaviors so that later as comprehension improves, your child is not limited by his wrong behaviors. So there are children who do fabulously. They are speaking, they are studying, they can read, they can write. However, they have scratching, biting behaviors, they will shout, they will throw tantrums. So, if you have not worked on them when they are young and you have made it very clear that this is inappropriate behavior, you will continue to have these problems which will limit the child's development, and that will be very unfortunate. So let's look at another example.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So we keep showing these parents, these children rather, because these are children who are right there in front of our eyes, and we keep seeing their development year by year by year. Children are now 10 years plus. And Rick, whom you saw, you can have a conversation with him. He will come and ask you questions. He has learned to play the keyboard, and he can play the Indian national anthem, which he did play in our Autism Day program. Eric, who was moderate to severe affectation, he is now able to communicate his needs verbally, apart from using an app. He is an amazing swimmer. Lenny, who was the most severe, can sit through a 3-hour meal discussion without any trouble, is very responsive to being held, and again has come from severe to moderate. So this is of course work in progress, but children continue to evolve, continue to improve, and it's amazing to see what they were the first time when they came. I can never forget that visual, that 3 children, can you imagine 3 children with 2 parents, and there was a room which we had emptied out for them completely, no refrigerator, no microwave, no gadgets. These children were running back and forth and spitting all over the place. And now when we see them, we feel so proud to be part of the journey, the journey of improvement, continuous improvement. So similarly with Ganesh, we keep seeing his improvements independent of what we have done. So it's a extremely proud feeling that we have been able to make a difference in the life of these children. This is a child, again, individual came to us when he was 13 years old from Kenya, practically inside the home, extremely hyperactive, extremely aggressive, absolutely had no awareness, of course no speech, no comprehension, running around, moving his clothes, rolling on the ground, throwing tantrums. And after stem cell, over a period of time, over a few months, years, now he is settled down, he is more responsive, he goes to a special school, his fine motor has improved, he started some articulation, he can swim, which was not possible earlier, he can ride a bike. So, he has come a long, long way. Now, this is a child from South Africa. This is how he came to us first time, totally listless, uninterested, and had so much difficulty in sitting in one place. After a year, this was how he was. He was sitting, he had some words, very few monosyllables. Second time, better words. sitting with a speech therapist and doing fine motor activities. Here, therapist is trying to make him look at the different animals, but he's resisting. Difficult to make him sit. Here he's sitting and putting puzzles. So this is first time. This is after a year. And after this, now let me show you how he is now.
Once upon a time, Pete the cat was walking down the street and his brain knew white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love.
Sorry. So that is Zach. I'm sorry, I think you're not able to see the message with some mom.
Once upon a time, Pete the cat was walking down the street and his brain knew white shoes. Pete loves his white shoes so much.
Who is
he
now
sang this song.
He's become obsessed actually with the
I love my white shoes. I love my white shoes.
And you know,
I love
you
my
listen to this video throughout, he's making up the story as he goes. His reading is better than
Pete standing in a large pile
understanding is better. So he's
strawberries.
completely working now. So much better.
What
than
color
what
did it turn his shoes?
So that was about autism, and more can be found on our website. We keep updating information there, so do have a look at there. We'll go to cerebral palsy now. So cerebral palsy, when there is a lack of oxygen to the brain leading to severe brain damage, could be because of a problem before birth, during birth, or shortly after birth. And depending on the area of the brain that is damaged, you will see the affliction. So if there is one side of the brain which is damaged, you can see this motor area which is damaged. So right side of the body is functioning less. If both motor areas are affected, then both the right and left side of the body is affected. If more extensive involvement, then you will see neck down paralysis or quadriplegia. And depending on if there's a basal ganglia involvement, if there's a dystonic or althetoid cerebral palsy, and if it's a cerebellar affectation or small brains affected and ataxic cerebral palsy. This is a brain. You can see severe damage here. The black area means complete scarring. The blue area means low functioning. So stem cell will help to salvage the blue area. What is black is completely lost. It is scar, it is fiber tissue, nothing can be done about it. But the blue areas are salvageable. What do we have so far? We have medications to reduce spasticity, control the movements to some extent, stool softeners, anti-epileptic medications. We have Botox, which can be given locally to reduce spasticity. We have surgeries when there is extreme tightness and spasticity, dorsal rhizotomy, cutting of the nerve roots to reduce the spasms or spasticity. Or here you can see the tendon release at the ankle to reduce or open up the tightness so that the ankle can straighten. So these are all surgical methods or medications, but brain functioning per se is not handled by any of these methods. So stem cell therapy appears to be one of the very few methods that can help improve the brain functioning per se. So having treated over 2,000 patients so far, this is an outcome of about 600 patients where 91% showed improvement to various degrees. About 10% will not show any improvement at all. So what do we see improvement in? So broadly speaking, this is how it works. The central or axial line develops first. So comprehension, understanding, learning. Then we look at it, oromotor, tongue movement, lip movement, chewing, swallowing, neck control. And neck control improves, then trunk control will come. So this is the biggest challenge. Once the neck control comes, then sitting, all fours, kneeling, kneel walking, better trunk control, standing and walking can happen. So first neck control is done. Hand function, and then hand function, getting to the midline, using the hand to do activities. So this will happen later. So central part works faster or develops faster. This is, you can see the blue areas and the green areas. The green area, the blue area will improve, and the black area remains as it is. Let me show you. Yeah. So you can see the blue areas here. Before the treatment, 6 months later, has started developing. The functioning of these areas has started improving. So you can see here again, blue areas. So this has become more green and yellow red, so more active. So the publications, one of the first few publications in 2015 on cerebral palsy. These are all our publication along with case reports, a few videos. This is a child who had severe brain damage. You can see only upper part of the brain is there, lower part is not there. And then over 32 months, you can see that the brain is much better developed. This is, you can see how he was before. No neck control, hardly any neck, no trunk and neck control. While pulling up also, you can see no neck control. Here you can see the development. Neck control improves, his face is looking much more better. Sitting, you can see sitting much better. No neck, no trunk control, sitting better. Sitting balance is improved. Therapist is working with him, or therapist went home also. Standing, trunk control, hand function. And then we started making him walk. So only when neck control and trunk control improves can you teach walking. So this is very region over 2 to 3 years. This is a child from Kenya who needed complete support while standing. You can see here, he was not even able to stand when he came to us. So you can see now he walks, though with a different pattern, but we started first with walker, and then he started walking, and then here it's at home on rough surface. So this is how the development of this child is happening. Again, this is a child who was completely wheelchair bound when he came to us, 14 years old. Cognitively good. We worked on his trunk control, his hand function, all of these areas, using his hands. So holistic work is done, not only walking, use his hand to open this so that he can be independent within the home. He was studying, but he needed support. So here you can see a child was completely wheelchair bound and is now walking. It's amazing development. This is a child with ataxic cerebral palsy. Again, very little trunk control, too many of extra movements, speech is not clear, cognition is less. So slowly, earlier with weights, and then now without weights, he's able to walk. His understanding is so much better. His speech clarity has come. He goes to school, he studies. So that's what we finally want to do, be able to make children go to school and be able to study, even if in a modified way. But we have to clear the path. We have to make the road ahead, or the prospects of positivity or possibility of hope has to be there. So he's even, is he climbing downstairs? Motor improvement. Hand function, pencil grasp, or reading. For a child who didn't have control of his own body, is doing very fine activities now. Brushing his teeth. So it's not just walking, but also brushing, eating by himself, wearing clothes. So we believe that we have to work on every aspect of a child's development. Identifying various animals now.
बोल सको इटा अरे इटा
Ears kind of very good.
Started writing also. So he's ataxic CP. Please remember that he has control issues. He's saying Johnny, Johnny, yes, Papa. So a child who could barely speak is now telling rhymes. So again, there are lots of such positive stories which gives us hope every day that, yes, it's possible to help a child become independent. So this is about a little bit about intellectual disability. Again, brain affectation, cognitive function is affected. Sorry, you can see these blue areas are functioning less. Out of 247 patients that we have studied, about 40%, about 85% show improvement, while 13 do not show an improvement. Improvement is in cognition and remote memory, problem solving, understanding, relation, social inhibition, and toiletry. In the blue areas, functioning less, they're more active now. First ever publication on intellectual disability. So a lot of focus on autism and cerebral palsy, but really people forget this other very important neurodevelopmental condition, that is intellectual disability. Now, intellectual disability can be because of lack of oxygenation, but also a lot of genetic conditions as well. Whatever may be the cause, what are we looking at? We're looking at the brain functioning being affected. So stem cell therapy with one's own cells helps to improve the brain functioning. So irrespective of the cause, the brain functioning can be improved with stem cell therapy. You can see the brain. You can see the brain. It's suppose the brain atrophy is there, the cerebellar atrophy, the cerebral atrophy. So with the blue areas, now after the treatment, you can see they are becoming green. So the objective improvement in brain activity can be seen after the treatment. Similarly, you can see here. Sometimes they also have physical affectation. So these are the articles or publications on intellectual disability. Now, this is a patient, again, very, very proud of her. 26-year-old who came to us. Cognitively, speech was there, but of course, comprehension was affected. She had a lot of fears. 26 years, she would sleep in the same room as the parents. So after the treatment, we recommended that start treating her.
Very nice.
Cooking,
smells good,
dance,
looks good,
dancing,
and with
communication,
stew, perfect combination.
So so much. So if we start younger, we can see the bloom much better. Again, Down syndrome, one of the common chromosomal conditions, hence I've taken Down syndrome, where 21 number chromosome is instead of being 2, instead of being a pair, is 3. So trisomy 21 symptoms, as we know, not only brain development, but also the faces is different, tongue is bigger, there are epicantral folds, the occiput is flat, neck is short, finger, there's a palmar crease, fingers are incurved, sometimes may have cardiac issues, may have thyroid problems, could have a hernia, the height is reduced, sometimes there's a risk of leukemia as well. So we can't really, each of these have their own treatment possibilities. Like if there is a heart condition, that you need to either give medications or surgical treatment. If neck is short, you can't do really much. But the thyroid hypothyroidism can be treated with medications, and leukemia has to be picked up early, and usually childhood leukemias usually go on to remission and never exacerbate. So, but brain conditions, understanding, cognition, speech, Sometimes these children also have autistic features and sensory issues. So can we work on these? Yes. So rehabilitation comes a long way, but brain using stem cell helps the rehabilitation to improve in its outcome. So again, the publication, everything that we study, we publish. So these you can see again, blue areas becoming green. The understanding area improves, the processing area improves. So because every child, the brain is different, but this is just an example. Let's look at one improvement video. This is a child who came to us when she was 12 years old. Now she's 15, 16 years old. She improved beautifully. She had low muscle tone. Gross motor activities was also not possible. Fine motor understanding. She was going to a special school, but really did not had much understanding. Speech was very, very difficult. What she was saying, but hardly make out. So improved in all areas, from fine motor to gross motor to understanding, comprehension, learning faster, speech, coordinated activities, dancing, helping at home. So all these areas she has improved beautifully. So I believe that if we start again the intervention early, we can really help improve the child's functioning later life as well. 5. Yes. 5. Yes. Mera dekho. 5. Yes. Fix it. 1, 2, 3, 4, 5. You can see that speech was so difficult to comprehend and understand for us. The speech clarity has really improved. So there are many such examples of Down syndrome. Also, let's look at possible complications of stem cell therapy. So complications, no major adverse side effects that we see, no irreversible neurological deterioration. However, a possibility of a headache, nausea, a spinal headache is seen in about 10% of the patients whom we treat every week. This is a self-limiting transient headache which may occur and may be there for 2 to 3 days. Epilepsy or seizures or fits is possible in 3 to 6% of the patients who have a history of seizures or whose EEG is abnormal. So in case that we do see such possibility, we would start a patient on anti-epileptic cover to ensure that this stem will be, after procedure, the child or individual does not end up having seizures. The third aspect of today's recent advances is the integrative therapy. In short, I will talk a little bit about hyperbaric oxygen and ozone therapy and deep tissue mobilization. So a combination of these helps overall wellness, and we have incorporated this in our treatment for neurological conditions because we see that this integration works beautifully. So stem cell helps to improve blood supply in the brain. It stimulates the brain functioning. Rehabilitation complements it, and oxygen therapy in turn helps these cells to work better, as well as improves the reparative process of the cells as well as the brain tissue themselves. So this is improved oxygenation. What we breathe is about 20% oxygen at normal atmospheric pressure. Here the child along with the parent is in a chamber where 100% oxygen is provided at slowly increasing pressures. The increasing pressure is important. And here now the child is watching a television which is outside the chamber to be occupied. So the principle is, this is a blood vessel and you can see a red blood cell. Oxygen is generally carried via this red blood cell in a normal atmospheric pressure. At increased atmospheric pressure, you will see that apart from the red blood cells, the plasma is diffused completely with oxygen. And this increases the oxygen transport capacity of the blood and the plasma, and more oxygen is reaching all and each and every cell of our body. Benefits: strengthens immunity, stimulates oxygenation, improves metabolism, it increases immunity, it reduces fatigue, overall improves functioning and stimulates the stem cells in our brain as well. Ozone therapy is another way of improving oxygenation. Here, instead of having 2 molecules of oxygen, we have 3. So ozone is basically medical oxygen converted, O2 converted to O3. You can see the bond between the third oxygen molecule is unstable. That means as soon as it goes into our system, it breaks open, and the apart from getting more O2, we also get a very strong active oxygen which acts as a germicide. So it kills off. So what does it do? It kills viruses, bacteria, and fungi in our body. It reduces inflammation and swelling. It reduces the clot. So more blood supply acts as an antioxidant. It can be, so how is ozone delivered? It can be delivered as a sauna. It can be delivered through nose, known as boto, via this oil base. In children through ear using a stethoscope, or through rectum as an enema. So it improves oxygenation throughout the body and the brain. It improves gut health. It acts as a potent anticoagulant. Reduces inflammation. Gut cleansing. Gut cleansing, there are different ways. One for adults is using hydrocolon therapy, and enema for children, or even ozone therapy. Basically, cleansing the gut is important so that better we can again put good bacteria, probiotics into the gut and help the nutritional absorption better. So all the muck in the gut can be cleansed, and thereby better nutrition can be helped for, we can help our gut absorb better nutrition. This hydrocolon therapy is basically for adults. In children, we do not use hydrocolon therapy. Now, acupressure, again, this pressure points massage, very mild, very systematic massages, which help to get the child to calm down and improve the blood supply. Okay. So everything works towards improving oxygenation in our body, which is one of the major causes of any kind of ailment in our body. It uses muscle tension, helps self-soothing, improves circulation, vitamin therapy, intravenous or oral as required. So these are all integrative therapies integrating into the process of neuroregeneration and neurorehabilitation. This is NeuroGen Brain and Spine Institute, and we have another sister concern for wellness and anti-aging. We have treated over 12,000 patients from 75 different countries. This is our whole team, the pillars who help start NeuroGen and form the basis of all the treatment processes and protocols. If infrastructure has a standalone hospital, with here is near a very beautiful lake and the beautiful city of Navi Mumbai. Operation theater, well, and just next to it, within the same OT complex, is the stem cell laboratory. So nothing goes out of, no cell goes out of this particular complex. So nothing goes out of that flow. Everything is within that OT complex. Our stay facilities, comprehensive rehabilitation, neurorehabilitation, and care by a multidisciplinary team. Combination works best, whether it's a physical ailment or whether it's a cognitive ailment. For any tree to grow, it needs both factors and signaling, and that's where the integrative approach along with rehabilitation helps. Our rehab physiotherapy setup, one-on-one care, no big machines used. Occupational therapy, we believe that healing touch of the therapist is very important. Autism Child Development Center. This is very child-friendly and children love to play here. Spinal cord injury walking track. This is to help physical ailments like muscular dystrophy, spinal cord injury patients to walk better. Sensory integration room, where we help the child to learn to integrate his senses better. Part of occupational therapy again is teach the child to work, play, and do his own activities. Speech and language therapy, art therapy, dance therapy. These are our publications. which are all available online. These are books for accreditation and awards, international awards, as well as so we believe in creating awareness and about possibility of helping an individual or a child with neurological condition lead a better quality life. This is how you can reach us. This is our website, neurogenpsi.com. You can email us at contact@neurogenpsi.com, and we can set up a virtual consultation online. You can reach us on this phone number. Once you've taken an appointment, a coordinator is allotted who will help you right from connecting to the doctor to the final process of arriving at NeuroGen. We have two kind of programs, 1 week program and a 2 week program. We started with a 1 week program because we believe that stem cell treatment has to be combined with the rehabilitation process. Many parents tell me, oh, we are in the US, we are in the UK, we have good rehabilitation. But I tell them, just be open. Just look at what we have. We may be able to get some more inputs about your child here, what you may not have got from other places. So the first 2 days is about understanding the child a little bit, do the blood workup, look at the brain scan. The third day is about the treatment, and Wednesday to Saturday is, of course, more therapy, as well as, again, knowing more about the child, understanding the parents' problems, and help you give way ahead what to do next. Because this 1 week treatment is not the be all and end all. This is a start. This is the ignition of the program. Now we have extended this to a 2 week program where, along with the general treatment of stem cell and rehabilitation, we have added integrative therapies, which will continue. So integrative therapies help, along with rehabilitation, help stimulate the cells better. And we find that integrated approach works very well. So that's why the 2 weeks. Now, why NeuroGen? There are so many stem cell centers all over the world. So why NeuroGen? What is different about NeuroGen? Because NeuroGen focuses on scientific aspect. We have the largest number of scientific publications in the world, 106. We have book chapters and international book. We are the only stem cell center that focuses on neurological conditions. We use safe stem cells from our patient's own body and inject intrathecally so that the cells reaches the brain directly. Along with stem cell, we have a comprehensive rehabilitation program and, of course, integrative therapies now that we have added it. We believe in continuously evolving our process. That's why we have an institutional committee which monitors the therapies that we do. And this institutional ethics committee is monitored by the government-approved CDS-CO, which is the equivalent of US FDA in India. We have treated over 12,000 patients from 75 different countries over the last 14 years, and we keep researching what more can be done, how better can we help patients who come to us. So in conclusion, adult stem cell treatment using patient's own bone marrow is safe and effective treatment for autism, cerebral palsy, and other neurological disorders. So this is a journey of hope of cellular therapy and integrative therapy and rehabilitation, where so many parents come to us who have lost hope, who have been told nothing is possible. And this works as a way ahead for every parent keeps on doing the best that he or she can, keeps on giving their best in terms of training, of nurturing. But what we are doing is helping that nurturing reach to a positive outcome. Thank you for
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So this President Obama's video is inspirational. It is a pivotal point in the history of stem cell field, the field of research and treatment, because in 2008 when he became the president, he reversed the ban on embryonic stem cell research. But till that time, there was a lot of resistance in the US because federal funding for embryonic stem cell was stopped by George Bush. So in this 8-10 years, a lot of work happened in the East, and that's why the East is the pioneer, the torchbearer in regeneration and the field of research of stem cells. However, very inspiring message by President Obama, which helps us to always sum up what we are doing, basically removing the words incurable, terminal, untreatable from our vocabulary as far as neurological conditions are concerned. So you can reach us on all these email addresses and phone numbers, and I would be now taking your questions one by one. Adnan is saying, I have glycogenose type 3A. Do you have a therapy for me? Adnan, we will really need to understand your problem better. What are your symptoms? Which part of your nervous system is affected? So we will reach out to you and understand your problem and will be able to give you an answer better. What is the cost of stem cell therapy in a child that's less than 5 years? I would like to tell you that I will be talking about medical questions here about the stem cell process, or about the cost and logistics. We will reach to you separately and give you various options. Dolu Hutari saying, my question is, why do Western side of the world reject the treatment? They say people prey on the vulnerability of parents with autistic children to earn money. And what do you say on that piece? So if that's the reason I ended with President Obama's speech. That is one of the important milestones, or one of the important parts of the politics of stem cell research, unfortunately, in the Western world, because things got delayed. They have not gone ahead. There is a lot of politics behind it. There is a lot of questions, because in the Western world they are still not at par with the research. They are unable to do the treatment there, and hence they would use those excuses. So everything that happened so far was as per the paradigm laid down by the Western world. In case of regenerative medicine, the path is being shown by countries from the East. So Western world has to still accept that. But yes, there are lots of doctors who will bring their children to us. There are people who are well-read who come to us. Okay, so I'm sure it's not, and there are these options available in the Western world also. There is Panama, there is Mexico, where patients do go. So because I would say, because they are unable to do the treatments there, that's why those questions. Nilesh is asking, when can we book an appointment? Let us know. We're waiting for doctor to have a word with him. Nilesh, let me check why you have not got an appointment, and we will try to make it as soon as possible. What is the benefit of 1-week treatment and 2-week treatment? What's your advice for parents who are planning to come for treatment? Should we go for 1 week or 2 week? Otherwise, very educated. Thank you, Tolu. So, up till 2 years back, we were doing the 1-week treatment. In fact, in most places where stem cell treatment is being offered, it's stem cell and then you go back home. Right from the very beginning that NeuroGen was started, we had the 1 week program, which nobody had, with stem cell and rehabilitation. Now our aim is to make this treatment more and more efficient, and that's why this 2 week program. In fact, there are patients who stays for 40 days as well. Those are patients who are in vegetative state and comatose stage, for whom we have extended 40-day program, like a 6 weeks program. So 2 weeks definitely would be better. 1 week is good. It acts as a peg around which the rest of the therapies will work. But if you can, if you do have time for 2 weeks, do opt for the 2 week program. Nilesh, we will try to definitely find a way for you to talk to the neurosurgeon. See, it is we do try, Dr. Sharma and myself do try to talk to patients as much as possible, but we do have our juniors who can answer all your questions, but we will definitely try to get you an appointment. Mr. Mona Osman, your daughter is Rett syndrome. She had spinal surgery. Would it benefit to help her speak, work with her hand, and get back to her life? Rett syndrome earlier was part of autism. Unfortunately, because of its degenerative condition, it is no longer part of the autism spectrum. It's a degenerative condition where a child doesn't, reach the milestones and starts degenerating. We will really need to understand your child's condition better and why she had a spinal surgery. Was it for scoliosis? In Rett syndrome, our main aim is to stop further worsening. And to maybe get some motor improvement as well as improvement in awareness. Whether she will be able to make her speak, we will need to really know the age of the child and the condition. Severe Rett syndrome, we may not be able to help in speech or vocabulary. Mr. Javed Haider, thank you for attending and appreciating. Mr. Raju Medishetty, why should everything come from Western countries? That's my question to you. Why we should follow everything that is coming from Western? Duke University is following what NeuroGen is doing. Duke University, in fact, in order to show evidence of stem cell therapy, gives NeuroGen publications to the parents to give them an evidence to say that this information or data is available. Why can't we start believing our own science and therapies? There is enough evidence. I showed there are publications. Please do go through them. Sami, we can get your appointment for consultation in the next coming week, and for treatment September. We have a couple of months waiting, so maybe like a September or October you can get the appointment for treatment. I think I've answered most of the questions. Thank you for attending. If there are any more questions, we will reach out to you, and please do feel free to get in touch with us. I hope you have a good weekend. Sorry for my cough. And have a great weekend, and some question has come now. Need to have appointment to discuss the situation? Yes, Mr. Mona Osman. One of my colleagues will reach out to you and discuss further options, and if necessary, I will also talk to you.